Welcome, welcome. I see a lot of people are joining us. See 14 people, 16. This number is going up really quickly. While we wait for some of your peers to join us, if you would like to chat where you are joining us from, that would be great. You'll be meeting lots of students and lots of campus partners. Okay, I see lots of people joining us. Welcome, welcome. Okay, I see Youth is joining live from Cambodia. I'm gonna allow you all to see where you're all joining from. I have Ridi from India, Kemo from Gambia, Lisa from Duluth. That's where I did my undergrad. Please keep on typing where you're joining us from. Great, I see Shahana from Baku. One of our friends is from over there too. I see Minneapolis, Switzerland, Sweden, China, India, Minneapolis, Taiwan, Belgium, Shanghai, Cyprus, Philippines, Peru. Okay, well, keep on typing where you're all joining from. I see Spain. Great, congrats on your recent win. Dominican Republic, Taiwan, Ecuador, Guatemala, Japan. Great. Well, I will get started with today's Global Gopher Experiences webinar on health and wellness. It is my honor to welcome you all to today's webinar on how to navigate health, including navigations and how to stay well when you arrive here to the University of Minnesota. My name is Marina Uehara. I use she, her pronouns. So when you refer to me, those are the pronouns that I would like for you to use. You will see a lot of our staff and students today are sharing the pronouns that they are asking you to use when referring to them. This is a common practice that we have here at the University of Minnesota to share pronouns. We don't want to assume, so this is an easy way to making it easy for you as you're referring to us. I am a staff here at International Student Scholar Services. I'm the Director for Student Engagement. And just like many of you, I was an international student from Argentina and Japan. My mom is from Japan. And I remember coming here as a new student and having to navigate US healthcare. Many of you are going to be asking us questions around immunizations, vaccinations, and in generally how to stay healthy. And it's not just maintaining about your physical health, but it's also your mental health, or like some of you want to call it, your heart and your well-being. So we are going to be sharing a lot of resources with all of you. And just a reminder that the US healthcare system is unfortunately extremely complicated. I oftentimes tell Greg, who is the director of the Office of Student Health Benefits, how complicated it is. And oftentimes he tells me, well, I also don't know how to navigate it sometimes. So we have lots of US citizens that have a hard time understanding it. So today we're going to give you some tips on how to make it easier for you to navigate, give you information about the resources that are available with you with Boynton Health Services, and how to stay well in navigating well-being with housing and residential life as well. Hopefully you will be able to ask us lots of questions, but we also have a lot of pre-submitted questions. And I'm going to go ahead and pass it on over to Daniel to introduce what to expect today at today's session. Daniel, please.
Thank you, Marina. Hi, everyone. My name is Daniel, and I'm a current third-year undergrad student studying computer science, and I'm from Singapore. Please do take note that this webinar is being recorded and will be posted on the ISSS website. General information will be provided, and you may have to reach out to an office about specific questions if they're not answered in the webinar today. The first 30 minutes will be about presenters introducing themselves and talking about relevant information to their office and health and wellness. And the next 30 minutes will be a question and answer session with the common pre-submitted questions that we have. Questions can also be submitted via the Q&A function, and it is located at the bottom of your screen in your Zoom panel. You have the ability to submit questions anonymously, so please take the time to ask us anything that you think may be important. Thank you for listening. I will now like to introduce Gracie Kibbert, Communication Specialist at Boynton Health. Gracie, please.
Hi, I'm Gracie. I'm from Boynton Health, and I'll be telling you a little bit about what we do on campus. We've been taking care of university students at Boynton Health for over 100 years and are used to working with people who may be unfamiliar with the process of scheduling appointments with us. Here at Boynton Health, we're committed to empowering you to take your health into your own hands while you're on campus. Let us be your first call when you're not feeling well. Boynton Health is a comprehensive college health service where you can receive almost all of the care that you'll need while at the university. That includes a pharmacy, physical therapy, and a nutrition clinic. All of these clinics are located conveniently in one building right on campus with care teams who work together. And don't worry, our health providers are not students or grad students. All are accredited medical professionals with years of experience in their respective fields. The East Bank, Minneapolis location is our main clinic and offers all of the services I just mentioned and more. We also have a smaller St. Paul clinic, which offers primary care, mental health, physical therapy, nutrition, and Gopher Quick Clinic services. Our main clinic on East Bank is open Monday through Friday during general business hours. If you need help outside of Boynton's hours, we also have after-hours care information on our website and also have a 24/7 nurse line available. Additionally, you can receive mental health services on the West Bank and physical therapy visits at the rec well. There are several ways to make an appointment at Boynton Health. You can call to schedule an appointment, and some, but not all, types of appointments can be scheduled online. The urgent care clinic specializes in medical problems that should be seen in a more immediate way than regularly scheduled appointments. These conditions include headache, flu, frostbite, work injuries, nausea, and others. And we also have that 24/7 nurse line available, and you can call anytime if you have questions about symptoms or are unsure if it's time to see a doctor. I know that there's a lot of information coming at you today. So before I move forward, I want to give you a direct link with information you need regarding immunization and vaccination requirements. The university does have an immunization requirement. Students are required to have the following immunizations: diphtheria, tetanus, and the measles, mumps, rubella vaccine, which is distributed as a single MMR vaccination. You will need to locate the form on Boynton's website to self-report the dates that you received these immunizations. Once that form has been completed, you've satisfied the requirement and you're good to go. If you still need the required vaccinations or would like any of the ones we do recommend, they can be taken care of at Boynton Health as well. Students have until the 6th week of class to complete the vaccine requirement, so you can set up an appointment to get this completed once you arrive on campus. The Mpox vaccination is also available and recommended for those who meet the eligibility criteria, which can be found on the Centers for Disease Control and Prevention website. You can also call us with questions. While COVID-19 may be less of a concern for some of us than at the start of the pandemic, there are still measures you can take to keep yourself and the university campus healthy. We recommend staying home if you're feeling sick, testing for COVID-19 if you feel sick, and following isolation guidelines if you test positive. Boynton offers PCR testing as well as rapid tests in our pharmacy. We also recommend staying up to date with COVID-19 and influenza vaccinations, as I mentioned. Boynton Health offers vaccinations on a drop-in basis in room W227, available Mondays and Wednesdays, 10 a.m. to 2 p.m. We also recommend washing your hands with soap and water on a regular basis. And you can check out the website for forums on making up work with your professors. In the bustling and often stressful environments of campus life, students can face a variety of challenges, from adjusting to college life and managing academic pressure to dealing with personal issues and mental health struggles. Boynton Mental Health provides a supportive and confidential setting where students can seek professional help. By offering counseling services, psychiatry, group therapy, and emergency mental health support, Boynton Mental Health helps mitigate these challenges. This support not only aids in the immediate well-being of students, but also in long-term academic and professional success. Our services usually require a 2-week wait, which is less than most clinics. Boynton Mental Health provides a supportive and confidential setting where students can seek professional help. As a patient, you have choices, rights, and responsibilities. You will not be required to waive your rights as a condition of obtaining healthcare at Boynton Health. Your information is between you and your provider. Staffed by pharmacists and support staff who are experienced with student health issues, Boynton Pharmacy goes above and beyond, to serve your students. Our pharmacy is conveniently located at our East Bank Clinic and offers a comprehensive retail selection tailored to support the health and wellness needs of students and their budgets. Pharmacists spend time educating patients about their new medications and are readily available to recommend over-the-counter products. You can visit the Boynton Pharmacy website for an easy and secure form for transferring prescriptions or to learn more about our products and services. Boynton also supports several programs that promote health campus-wide. One of our largest public health initiatives is the Share the Air campaign. The university is a smoke and tobacco-free campus, both inside and outside. This policy prohibits the use of e-cigarettes as well. We're also working to address food insecurity on campus. Any student can receive fresh and healthy food for free. The food pantry is open 3 days of every month during the school year, and you can find the dates on our website closer to the beginning of the school year. Boynton also operates the Gopher chauffeur service as well. Gopher chauffeur offers free, safe rides home for students in nearby neighborhoods, operating 7 nights a week, and you can request a ride through the TransLock app. Rides run throughout the school year, and you can download the app, and Gopher chauffeur will provide a free, safe ride home. One of our most popular and cutest programs is PAWS, which stands for Pet Away Worry and Stress. Therapy dogs, cats, bunnies, and chickens, and mini horses hop or trot onto campus every week, and these animal-assisted interactions help reduce student stress. Students play an important role in our health promotion efforts on campus as well. For example, we offer a health advocates program. Health advocates are student health resources in residence halls, apartment communities, and fraternities and sororities. Boynton Health understands that it's important for you to connect with peers on campus who can answer health questions and provide resources. These health advocates are first aid and CPR certified, respond to common health-related issues, share info and prevention strategies, refer to other campus health resources, and help distribute cold, cough, and pain medicine, cough drops, bandages, safer sex supplies, and more. Here are some other health promotion resources we offer. We offer free safer sex supplies for discreet pickup at our pharmacy. You can find the form on our website. You can also contact your student health advocate or visit boynton.umn.edu/condoms. We also operate ROC, which stands for Recovery on Campus. Recovery on Campus is a student group that provides resources and support for university students in recovery through regular meetings and social activities. Again, there's no way to remember all of the information that I've shared, especially when you will need it. You can visit our website, boynton.umn.edu, or use this QR code for all I've shared today, as well as much more, including booking an appointment or finding our social media information. Thank you for your time. We look forward to seeing you. I'll now pass it on to Greg from the Office of Student Health Benefits.
Thanks, Gracie. Hello, everyone. My name is Greg Thurston. I'm the Director of the Office of Student Health Benefits. Today, I want to highlight health insurance requirements for the University of Minnesota, as well as some items related to health insurance in the United States that may be different from health insurance in your home country. As Marina said earlier, health insurance in the United States is complicated, even for those of us who were born here. In the few minutes we have now, I can only give you a general overview of how it works. The booklet with all the health coverage information, known as a summary plan description, is over 100 pages long and is posted on our website. You have the website information here. After this presentation, you'll likely have additional questions in the future. The Office of Student Health Benefits contact information is provided here, and I want to assure you that we're committed to helping you with any questions you have now or in the future. First, it's important for you to realize that unless you qualify for a waiver, the University of Minnesota requires you to be on either the university's student health benefit plan or the university's graduate assistant health plan. This requirement has been in effect for over 40 years and applies to all university students, both domestic and international. It's necessary so that you can focus on academics, not worry about whether you can obtain medical services if any health issues arise. Waivers from coverage on the university plan are only granted if you're remaining in your home country for the semester. Let's go back, please. Right there, thank you. Waivers from coverage on the university plan are only granted if you're remaining in your home country for the semester or have United States employer-based health insurance, or your home country has an arrangement with the university which qualifies you for a waiver. Only the countries of Oman, Saudi Arabia, United Arab Emirates, and Kuwait have arrangements allowing waivers. If you qualify for a waiver, you should email the Office of Student Health Benefits for assistance with the process. If you're a graduate fellow or graduate assistant with a qualifying appointment from the university, you should enroll in the graduate assistant health plan. The university pays a significant portion of the premium for graduate assistants, so your contribution is quite low. At the beginning of the semester, your account is charged $208.44. Excuse me. If your appointment is 50%, you pay no additional premium. If your appointment is less than 50%, you pay an additional amount for the semester based on your appointment level. You must complete an enrollment form to enroll in the Graduate Assistant Health Plan. To enroll, go to our website, shb.umn.edu, and select Graduate Assistance, then select Enrollment. Complete and submit the form to the Office of Student Health Benefits. Failure to actively enroll in the Graduate Assistant Health Plan will result in the graduate assistant being automatically enrolled in the Student Health Benefit Plan and charged its full cost of coverage. So if you're a graduate assistant, you don't want that to happen. You want to enroll in the Graduate Assistant Health Plan. Graduate students without appointments and all international undergraduate students not qualifying for waiver must enroll in the Student Health Benefit Plan. And coverage generally begins on August 19th, 2024. However, if you need services prior to that date, please contact the Office of Student Health Benefits And you can have, we can help have your coverage set as of the date that you enter the United States. The cost of the student health benefit plan is $1,795 per semester and is billed to your account at the beginning of the semester. To enroll in the student health benefit plan, click Enroll Me on the insurance plan communication that was sent to your MyU account. The Office of Student Health Benefits does not recommend purchasing any additional insurance, and even if you choose to do so, it will not allow you to waive off the student health benefit plan. Next slide, please. In the United States, even with health insurance coverage, an individual may have additional out-of-pocket costs when seeking medical care. Copays are small fixed dollar amounts that are charged each time you go to the doctor or have a prescription, with the insurance plan paying the remainder of the cost of the visit or prescription. With the student health benefit plan, when you have services outside Boynton, you may need to pay a deductible and coinsurance. Deductibles are annual dollar amounts which must be paid for services before the insurance plan begins paying for services. Coinsurance is a percentage of the claim that you must pay, with the insurance plan paying the remainder. However, all plans have a maximum annual out-of-pocket amount so that once you reach that amount, the insurance pays 100% for all remaining eligible claims. The Office of Student Health Benefits has detailed information on its website showing coverage levels for different types of services for each of the health plans. Next slide, please. Our plans are designed so that most individuals have very low out-of-pocket costs when obtaining medical services. Boynton Health is usually your lowest cost and most convenient alternative for medical care. In fact, most services provided by Boynton result in no out-of-pocket cost to those on the student health benefit plan and just a $10 copay for those on the graduate assistant health plan. The medical identification card you receive from the insurance company will have their website information, enabling you to find other available in-network providers when needed, such as if you require immediate care when Boynton is closed, or if you require a service not provided by Boynton. Our insurance company is called Blue Cross Blue Shield of Minnesota, and the provider network is called Aware. You will need your medical identification card when obtaining services or picking up prescriptions at places other than Boynton. If using a provider other than Boynton, it's important to confirm that they're in network before obtaining services, as you often must pay more out-of-pocket costs when utilizing providers who are not in network. It typically takes a couple of weeks to receive your medical identification card. If you need medical services prior to receiving your card, please contact the Office of Student Health Benefits for assistance with your coverage. We're here to assist you and help answer any questions that you have about your medical coverage. The next presenter is Katie Olson-Williams to talk about housing and residential life.
Thank you. Welcome. My name is just shared as Katie Olson-Williams. I use she, her pronouns, and I'm an assistant director in housing and residential life. Housing and residential life provides housing to over 7,400 students on campus in 17 buildings located on East Bank, West Bank, and St. Paul campus. We provide opportunities for students to meet others and have staff on site as a resource and for crisis response. In addition, we have almost 40 unique living learning communities where students live in a community with others that share the same academic goals or personal interests. We provide early arrival housing this year from July 21st through August 23rd in Centennial Hall. Whether or not you live on campus this fall, early arrival housing is only available for enrolled U of M students, as we can't accommodate families. Move out is Friday, August 23rd by 7 p.m. We will provide transportation assistance to those living with us in the fall if needed that afternoon or early evening. In addition, we will provide some opportunities in Centennial for you to be able to meet others. Move-in for fall residents to our apartments begins August 15th, and for traditional residence halls, August 26th. Assignments will be emailed out at the end of this month, and if you have not yet found fall housing, we encourage you to utilize our off-campus housing listings found at housing.umn.edu/other/off-campus, which I will get shared with you as well in the chat here momentarily. Pioneer Dining Center is also open this year in July and most of August. However, it's important to check the dining webpage for hours of operation, as some dates are unavailable. Dining is not included in the early arrival housing cost. However, if you arrive early and are interested, you may purchase dining dollars to use in the Pioneer Dining Center or other retail locations across campus. There are also other options near Centennial Hall for eating, and a kitchenette is available in hall to use if you wish to cook. Your health and safety is important to us. The page listed below here provides information for you to be aware of, as it is all of our responsibility. We no longer have any specific protocols for COVID. However, our website has resources available if you have questions about what to do if you feel sick, have been exposed to someone with COVID, and updates around policies such as masking. Masks are not required unless you are isolating, and community members are welcome to wear one if you wish. We encourage everyone to take responsibility for your own health needs and to do the right thing when not feeling well, such as testing and isolating if necessary. As a student, it is important to take care of your own well-being. There are several opportunities in Hall to connect with others, including jobs within housing and residential life. So you may actually live where you work and create and/or participate in one of our many groups. Our staff are available as a resource to you in each Hall community, but we all play an important role in our community. Should you experience or witness a bias incident, please report it as soon as possible to your CA, which stands for Community Advisor, or submit a report to the Bias Response and Referral Network so we can provide support and follow up. I will now pass it back to Marina from ISSS to lead the Q&A.
Thank you, Katie, and thank you all for presenting with us, Gracie, Greg, and Katie. I'm going to be asking Daniel to share with us first how to stay connected with all of us as you move forward. And then if you haven't noticed, there's a Q&A button. Please go ahead and submit your questions there. And we'll get ready in just a little bit for the live questions and answer. Daniel, please.
Thank you, Katie and Marina. Hi, everyone. It's me again. Really quickly, I just wanted to tell you guys how to stay connected. As you can see on the slide, there are our email and our website, and we also have Discord and Instagram. So really quickly, just wanted to tell you, if you have specific questions about your situation, you can always email those to the appropriate office. We will be sharing that information in the past and also in the future. Additionally, you can just email isssnew@umn.edu. Do note that at the end of this webinar, we will be sending out an email with the slides and the QR code, so you will also have access to that later in an email. Now I will hand it over to Alejandro, our sponsored student program coordinator, to take over the Q&A. Alejandro, please.
Thank you, Daniel. So we'll begin with the question and answer portion of the webinar. This will last for around 30 minutes. We will have staff moderating the chat, so please feel free to submit your questions in the Q&A portion. And we'll begin with some of the questions that we received during the registration process. So we'll start with Boynton Health. Can you explain how, for PH students, what happens when you are outside your funding band, and what is the cost of paying your own health insurance?
If we're talking about having to pay the full premium, I'm not sure I totally understand the question, but if you're saying the full cost of the insurance, it's and if so if you're on the student health benefit plan, the total cost of the insurance is $1,795 per semester. If you are on the graduate assistant health plan, the total cost, because the graduate assistant health plan is a much higher cost plan, if you had to pay the total cost of the graduate assistant health plan, it's approximately $690 per month.
Thank you. Another question that we received in the chat are there required vaccinations free of charge, or what is the total estimated cost for all the required shots?
Yeah, the required shots are all covered by the health plan, whether you're on the graduate assistant health plan or the student health benefit plan. They're covered 100%. So one of the things that I didn't go into in the presentation is that there are certain services that are considered preventive, and preventive services are covered at 100% by both plans. And these types of vaccinations, the required vaccinations, would be covered at 100% by both plans.
Thank you. We have another question in the chat. Some of the vaccines not provided in my country, can they receive the vaccine in Boynton after arriving on August 15th? And if they will be enrolled in the GA health insurance program, can this also work for the vaccine in August?
Yeah, you can get the vaccines listed in the presentation, which you'll be able to access afterwards. You will be able to get those here at Boynton Health after you arrive after August 15th. You can schedule an appointment to get those required vaccinations or the recommended vaccinations, or you can stop by our drop-in vaccination clinic on Mondays and Wednesdays.
Thank you. So this question is for the Office of Student Health and Benefits. When does the student health benefit plan start? If I land in the US before this date, then do I need to have some other health insurance in the meanwhile?
No, you don't need to get any additional health insurance. You know, the normal start date, I think I said was August 19th. Yeah, August 19th would be the normal start date. So if you arrive prior to August 19th, you don't need to have other coverage prior to that. If you know that you're going to need services prior to August 19th, then contact the Office of Student Health Benefits and we'll get you enrolled immediately in the plan.
Thank you. This question is for housing. So what measures are implemented in housing to ensure there won't be a COVID outbreak?
Hi. You know, we really put the onus back on all of us to take responsibility. We do have limited number of spaces set aside. Should there be, you know, somebody gets ill and if you have a roommate, you want to isolate in your own space, we do have a few spaces available. But really looking at the resources that we have on campus, utilizing Boynton Health, other resources to test, masking, washing hands. We clean our bathrooms daily. So again, provide, you know, resources to be able to also clean your own room. So I think that is the biggest thing that we can do at this point, and just really taking our, you know, our own health, making that a priority. The other thing is that if we do notice a trend, so we do track and monitor. And so if there are a lot of cases being reported, or if we're seeing kind of a trend, we do look at that and we'll make changes or do what we can to help support students to try and prevent it as best we can.
Thank you. And one of the questions also for housing was, what happens if I experience bias on campus?
So again, what we would want you to do, when we hope that that's not the case, right? We are hopeful that we are providing a welcoming and an inclusive community for everyone here. And so if that does happen, however, again, utilize your community advisor, make sure they are there for you as a resource, but reporting it truly is what we would like you to do. There are a lot of resources on campus to support you. And so, you know, as I mentioned, the bias referral network is somewhere we would want you to reach out to and get that reported. And they would assist with further support for you.
Thank you. Another question for the Office of Student Health Benefits. Is the health insurance applicable during the summer, or do I have to pay extra for it?
No, it's applicable during the summer. There's no extra charge.
Thank you. And for Boynton Health, can we have a more thorough explanation on the health benefits and insurance coverage?
Well, I think that'll be me. So the bottom line with it depends on which plan you're going to be on, right? It's the graduate assistant health plan or the student health benefit plan. If you're eligible for the graduate assistant health plan, so you're a graduate assistant with an appointment or you have fellowship, you want to sign up for the graduate assistant health plan. And the reason for that is that the university pays the majority of the premium for you. So you have a very low cost for the premium, and then you have very low out-of-pocket costs as well. On the graduate assistant health plan, it's generally a $10 copay that you pay for office visits, and then the insurance pays everything else. On the student health benefit plan, there are potentially higher out-of-pocket costs. When you use non-Boynton providers, you end up having a $250 annual deductible, and then you pay 20% of the cost thereafter until you hit a total of $6,250 out-of-pocket expenses. Now, you avoid all that by using Boynton, because Boynton works with the student service fees that you're also paying, so that most services that you receive at Boynton, the insurance pays a portion of it, and then the student service fees pay the remainder, so that you have no additional out-of-pocket cost. So in general, on the student health benefit plan, you want to make sure that you're using Boynton as your primary clinic.
Thank you. I will pass it back to Marina now to ask questions of our student leaders.
Thanks, Alejandra. And it sounds like there's just like so many questions from our students, and we're trying to quickly answer them. But usually what students want to know is, what is the experience of using healthcare? One of the questions we typically have is, will Greg and Gracie report that I'm using healthcare at your institution? And no, they are not officers that will be reporting to our office. So unless there's an immediate danger, they don't have to tell us. There's a thing called HIPAA that actually protects your information. So I'll ask Gracie to maybe talk a little bit about that later, as well as Greg, but I'll be asking our student leaders a few questions about what it was like to navigate the healthcare system. Is there any advice you would give to students about how to stay healthy and well? And so I would like to invite you first to maybe introduce yourself, and maybe share a little bit about what do you currently do to stay well, find that inner peace that you always talk about, and perhaps recommend one or two resources that you have used with either one of our campus resources today that you would like to recommend to students as they plan for their arrival.
For sure. Hello, everyone. My name is Mongrot Tayotingplet, originally from Cambodia, and right now I'm a summer break in Cambodia as well. I'm a PhD student in the College of Education and Human Development. And I've been in the U for 3 years, and as many as those resources are, I often that one person who stay up very late in the library. Translock has been super helpful in getting me home safely. Usually, it's also a good chance to meet with new people who will be sharing your ride all the way back home as well. And in addition to that, I believe like one of the most things that I actually access is the food pantry, which actually happened. The calendar for the new food pantry for fall will be coming, but they actually have a variety of food available, grocery available for us to pick up. I do love the free food every Thursdays as well. It's a Swipe Out Hunger program that you can actually access single quality food for you and your families if you're coming with family. And if you are living in off campus like CSCC or CTC, you actually have those delivery to your door. It's very close by to the community center within your area of living. And of course, I can't wait to also pet away my stress as usual with the beautiful chicken. I have my favorite dogs that will be arriving. Unfortunately, the dog name is also Daniel, which is adorable, just like my co-lead for the sessions too. So there's a lot of services that I strongly recommend you just enjoy and utilizing as much as possible during your time. Just make sure to also feel free to ask your friends. Sometime I think the journeys here is that clarity is difficult to search for, but then we are here to also support you, and feel free to reach out to us if you have any questions as well. Back to you, Marina.
Thank you, Youth. And you mentioned some really good resources like the food pantry. You do not have to say that you need to use the food pantry. That is something that all of our students use. Actually, a lot of our international students use that. Our grocery stores are, you know, they're pretty close, but the food pantry tends to be right on campus, and you just go in with your U-card and you just pick up food at no cost. So that's kind of a great way to, if you need a quick grocery run, you don't have to state why you're using the food pantry. Youth also mentioned PAWS, the pet away your stresses, and he mentioned chickens. There's also mini horses. There are bunnies. There are dogs and cats that you can pet that it will make your stress go away. I actually have my own emotional support dog in my office. So if you ever want to stop by and say hi to her, you can definitely do that. Thank you so much for sharing that. I know for a lot of grad students that are in here as well, there is a lot of food pantry vans that stop by the different grad school, the grad housing locations as well. So I'm going to be inviting perhaps Yulia maybe to share a little bit about what it's like to have, you know, be a sponsor student and navigating health.
Yeah, thank you, Marina. Hello, everyone. I'm a recent graduate from College of Education and Human Development, and I came here as a Fulbright student. So I just quickly share my experience. Thankfully, I didn't have a lot of experience with American healthcare. Maybe this is for good. But I did have a couple of appointments to Boynton. It was super convenient, super quick. And once I needed to, you know, to go through some, how should I say, medical treatment and get through a lot of analysis. And for my surprise, it was totally free. So our university health insurance is, you know, is very good for students. And I know some cases when, so as a Fulbrighter, I have two insurances. So one that Fulbright provides me and one that university provides me. And sometimes you can even negotiate. So even if you go out of campus, for example, you're going out of Boynton to some other hospital, you can negotiate. So one health insurance, like university health insurance, pays one part, and your sponsor's insurance pays another part. So this is pretty convenient, but you should be ready to talk. So you should be ready to talk when you're making appointments, when you're communicating with your insurance companies, and et cetera, et cetera. So yeah, this is just my real quick experience. And I can say just for myself, it was really hard for me to understand how it works as a person who came from country with a universal healthcare. And when, you know, everything is very, how should I say, affordable. But, you know, it turned out not to be as scary as I expected.
Thank you, Yulia, for sharing that with us. As you mentioned, you know, a lot of these lab tests and so on are you don't have to pay out of pocket. So they look like it's free, but you're actually paying for it through your insurance, right? So I think to Greg's point of looking at being in network, right? So Boynton tends to be your first choice because that is considered in network. It's a little bit easier to navigate. Some of that cost can also be charged to your student account as well. So it's a little bit easier to navigate as a student, but the Office of Student Health Benefits, if you contact them and you have questions about specific coverage, they're really good at answering that. And if you are unsure, you can always reach out to me. You can always reach out to Greg. And I know we are all able to answer your questions as much as we can. But to your point, Yulia, it's a good thing you didn't have to use any of the emergency costs, but our office does provide, if you end up having like an emergency surgery, appendicitis is one of them, or having your wisdom tooth removed, ISSS does have something called an emergency funding. And that is for things that you weren't accounting for you can't plan for your appendix to burst and get appendicitis surgery, right? So those are things that we can definitely help cover as well. I would also like to invite maybe Daniel to share, and then I'll invite Key as well to just share about what do you do to stay well during your university time.
Hey Marina, that's a great question. Thank you so much for asking me that. So as you guys know, we have a lot of clinics in Boynton. I have used, I think about half, I've used like the physical therapy clinic, the dental clinic, the primary care, and then immunization. So for me, what I like to do to, maybe like keep healthy and get on top of everything is I make a list of like what I have to do if I have to get a shot, or like a lot of times when you go for an appointment at the start, it's free. Like you don't have to pay because the U already covers it based on your school fees. So I would recommend for me just getting like that first checkup done to see what else you have to do. So paving the path for me is what I'd say when you first come to the U. It doesn't hurt to try out like all these services because they are covered by your insurance. So that's what I'd say. Pave the path for yourself and see what you can get free for. That's what I do. And it's worked out pretty well for me. So that's the one point that I would recommend. Key, do you have any points?
Yes, I also recommend get enough sleep, eat nutritions, go to the food pantry possible, and also drink enough waters, and importantly, reach out for help if you need it. So we understand like different cultures, like for example, in like Eastern culture, we might be like shy to reach for help when we experience like stress and anxieties, but it's understand that we live so far away from home and it's okay to reach for help. Boynton Mental Health or Student Counseling Service are here to help you overcome challenges in your life with you facing, stress, anxieties when you're studying here and adapting to like a new cultures, a new place. And both of those services are free and including the tuitions. And also all the information you share with the counselors are private and confidential, which means that they cannot tell anyone unless they have your permissions. So yeah, take advantage of those services.
Thanks, Key, and thanks, Daniel, for sharing that. A huge reminder that it's a good idea to use all of the services. Get your eyes checked every year. Use the women's clinic, use the mental health. We always hear from our therapists, best time to seek out mental health and therapy is when things are going well. So when a crisis happens, you're able to navigate that as well. Boynton will also be having an open house on Tuesday, August 27th during our Global Gopher Experiences in-person event. So I know a lot of students tend to sign up for all of their appointments at that point. Housing, for those of you living on campus and even with international early arrival housing, it's a great way to make friends. You are living there with a lot of other students who are going through the same process. And that's why we have our campus partners and Katie come here and talk about the benefits of living on campus or close in community. And we also have Greg and Gracie here talking about what it is like to navigate the healthcare questions, right? There is one more additional question, Greg and Gracie, that hopefully you can answer. I've seen this question come up. It's about enrollment of not about enrollment of dependents, but it is about services provided to infants. Does Boynton provide that, or is that insurance? Once you enroll in dependent insurance, that includes your child and your spouse, then there is insurance that covers those individuals. But the question is, does Boynton also offer services such as immunization, routine checkups, hearing, vision, dental, and emergency care for infants? Maybe I'll start with Gracie, because there's a question around services and then there's questions about coverage.
Yeah, thank you for asking. I believe that some services may be available for infant care. I'm not sure what services in particular.
Let me interrupt here, Gracie, because
that would be great. Thank you, Greg.
I don't know absolutely 100%, but my general understanding is that Boynton typically does not provide services for children under like the age of 12. So in terms of the health insurance, you've got great health insurance regardless of which plan you're on. So that's the good news, right? And your plan will cover your dependent, but I do believe that you would need to find a pediatrician from another local provider, and there are lots of local providers very close to the Twin Cities campus.
Okay, thanks, Greg. I wasn't sure, what was the age limit. Again, you can reach out to the Office of Student Health Benefits and ask for recommendations for providers, or if you end up having, for example, Medica, sometimes what I do is I look at what are the providers available that are considered in-network. And that's when they'll ask, that's good to have your insurance information, especially if you're going through Boynton, through the Office of Student Health Benefits. And then you can figure out who's going to be covered. But we live in the middle of the city. There's a lot of medical providers that are just around us. So it's really easy to get to other healthcare locations outside of Boynton as well. There's a lot of questions around. So I see that a lot of you are answering questions online. I did see someone that indicated that they're in remission for cancer and will need to undergo checkups every 6 months. Again, I think this is something that it's establishing a connection with a primary care physician here, a primary care medical staff here at Boynton, and I believe then they would be able to navigate your care as well. Would it be appropriate to say maybe the student that did submit this, I'll share my email with you, and I'll reach out to Gracie and Michelle Trumpy over at Boynton to just kind of figure out what the next steps are to make sure that your care is continued. But that's a very specific question, and I like to be able to address that, perhaps not live, but maybe with one-on-one connection. So to the student that submitted that question, I will be sending my email here. Please reach out to me and I'd be happy to kind of figure out what are the next steps, because it might be a combination of different resources. So I am glad that you're in remission and happy to hear that for you. This is the end of our webinar. We've answered as many questions as we can about remaining healthy and navigating health. I see that someone raised your hands. If you have a question, please email us at issssnew@umn.edu, and we're happy to help navigate some of those questions afterwards. But again, a huge thank you to Greg from the Office of Student Health Benefits, and Gracie from Boynton Health, and Katie from Housing and Residential Life for really taking the time to answer questions. As you can see, these are campus partners that are extremely supportive of international students. And you're probably going to notice there's a lot of people to ask questions. What we try to do every 2 weeks is just answer questions little by little so that you're not overwhelmed with a lot of information. And yet there is a lot of information. So if it's a question of where do I start first, just email us at issssnew@umn.edu, and we're happy to start navigating where to go next. And we look forward to seeing you in August when you arrive. I'm going to pass it on over to Daniel to do our final comments for today.
Thank you so much, Marina. Really quickly, y'all, the next event we have is Level Up for Career Success on July 24th. You should be able to scan that QR code. We hope that you have had a great time today, and I really recommend that you guys attend the next event because they're going to give you little golden nugget like information for how to level up for career success. So thank you so much. The QR code is on screen if you're able to share that. Really quickly, Marina, I'll just hand it back to you to take us out. Marina, please.
Thank you. And with that, it is the end of our session today. We're going to play a quick video. It's just a recap of what Gracie mentioned about what is Boynton Health, but it's a really fun video to watch. And with that being said, we'll be seeing you in about 2 weeks. Please register for that. Jaden has added on our chat how to sign up for that webinar. And again, thank you all, and we'll see you in about 2 weeks. Goodbye now.
Welcome to the University of Minnesota. We are Boynton Health and we're excited to help you get a strong start to your college career here. We understand that it can be overwhelming to take control of your healthcare needs. That's why we're committed to helping empower students like yourself. There are a variety of clinics you can choose from here at Boynton, from primary care, urgent care, Gopher Quick Clinic, dental and vision services, gynecology and gender care, nutrition services, physical therapy, immunization, and a pharmacy. And as a student, you can access most of these services at little to no cost.
So now that you know what Boynton Health has to offer, you might be wondering how to get treatment. There are many ways to access care. You can make an appointment by calling, stopping by in person, or visiting My Boynton online patient portal. Through this patient portal, you can access immunization records, receive test results, and update your patient profile. Not sure what kind of help you need? No worries. We have a 24-hour nurse line available to help you access the right care.
Of course, after you make your appointment, you might be worried about how much it will cost. As a college student, finances can be a huge concern. Most students can receive care at little to no cost. You must meet 2 criteria. You need to pay the student services fee for the semester that you're enrolled in, and you need to be on an insurance plan, either a private plan or the university's plan. Most students must have insurance to be able to attend the university.
The plan offered through the university is called the Student Health Benefit Plan. It is charged to your student account alongside the student services fee and tuition. The Student Health Benefit Plan fee varies yearly, so be sure to check out our website for the most up-to-date cost. You might choose to opt out of the Student Health Benefit Plan and might be worried about paying for Boynton's health services. Don't worry. Regardless of what kind of insurance you have, most students can be seen at our clinic at little to no cost.
Boynton Health also does a lot of public health outreach across campus. We work to promote the physical, social, and emotional well-being of all students across campus inside and outside the walls of the clinic. Be sure to take advantage of programs like Nutritious You, Food Pantry, and Gopher. If you're feeling overwhelmed, you can put away worry and stress with Pause.
If you're a student living in a residence hall on campus or a fraternity and sorority, talk with your student health advocates. These students are first aid and CPR certified and can help with other common health related issues by referring you to other campus health resources and sharing information. These students provide cough drops, bandages, safe for sex supplies, cold and cough and pain medicine. Other health promotion resources also include stress check-ins, safe for sex supplies, and Recovery on Campus, which is a student group that provides support and resources for university students in recovery through social activities and regular meetings. Boynton Health offers individual therapy, couples and group therapy, and student counseling services. We also offer stress check-ins. Stress check-ins provide an opportunity for you to talk through stress in your life, come up with solutions, and connect with campus resources.
You can find us on the East Bank Minneapolis campus and the St. Paul campus. We're open Monday through Friday during general business hours. Don't hesitate to give us a call or visit us at the clinic. You can find more information at boynton.umn.edu.
Be sure to visit MyU to fill out the immunization form and the insurance declaration form.